And now we will discuss Step 4. Train all staff so that they are able to carry out breastfeeding promotion and support activities. All staff must be trained on breastfeeding basics and the breastfeeding policy within 6 months of hire. The center should maintain a connection with the local breastfeeding coalition. This will allow new staff to be properly trained when hired, but also to ensure all staff stay up to date on the most recent breastfeeding information and events in the area. Employees should be able to identify and promote the location of the center where mothers can comfortably breastfeed or pump. Staff must be able to demonstrate proper storage and handling of breast milk. Breast milk must be labeled properly. No gloves are necessary. Breastfeeding must be promoted and encouraged to all mothers. Infant care plans are in place to avoid large feedings prior to mother's arrival, and all employees must be encouraged to attend a training or continuing education session on a breastfeeding session once a year. Safe storage. Breast milk does not require a lot of special handling. There are properties in breast milk that destroy bacteria. Milk should be stored in 1 to 4 ounce portions to help eliminate waste and make it easier for everyone. Breastfed babies typically do not take more than 4 ounces of breast milk at a time. Breast milk is tailored to baby's needs as baby grows. Formula-fed babies typically take in an increased amount as they get older. This is because formula is the same composition and you need to tailor the amount to meet baby's needs. Breast milk is designed to change to meet baby's needs as they grow and nutrient needs change. Storing in 1 to 4 ounce portions allows you to pull only what you need and avoid having to discard any extra. Milk should be clearly labeled with the infant's full name, date pumped, and amount. Clearly labeling each infant's milk containers decreases the chances of giving the wrong milk. In the center refrigerator, there should be a separate container labeled with each infant's name where the infant's container of breast milk will be kept. The oldest milk should be used first. Child Care Center staff should discuss these guidelines with parents and also show them where their milk will be stored. Storage guidelines. Breast milk can be kept at room temperature for longer than formula because breast milk contains living, working cells that fight off bacteria and germs. An example that many use is imagining the cells in breast milk as little Pac-Mans eating the bad bacteria and germs. You do not have to use frozen breast milk at your center. You can keep some frozen milk as a backup, but encouraging moms to always bring the amount she pumps and using that amount is recommended. Using more than what mom pumped the previous day puts her at risk for a decreased supply. Handling breast milk. Breast milk will separate into a fat layer on top and a watery layer on the bottom, and this is normal. Do not shake, just gently swirl the bottle back and forth to mix. Shaking destroys some of the properties of breast milk. To thaw the frozen breast milk, you can place it in the refrigerator for up to 24 hours, or you can run it under warm water at the time of use. Do not refreeze any leftover breast milk after warming. Any leftover milk needs to be discarded. This is why it is important to freeze breast milk in 1 to 4 ounce portions to eliminate the need to discard. Warming breast milk. Do not use a microwave to warm milk. Microwaves only heat pockets of milk and increase the risk of burning the infant's mouth. Microwaves also destroy some of the nutritional properties of the breast milk. To warm milk, put the container of milk under warm water, or you can put the container of milk into warm water, or use a bottle warmer. Excessive heat will destroy breast milk, so try to keep temperatures below 98.6 degrees. Breast milk does not have to be warm. Many infants don't mind the cold breast milk, so if your infant at the center does not mind the cold milk, there is no need to warm it. Feeding baby. Breast milk is designed to digest quickly and easily. For this reason, in the early months, infants feed more often than formula-fed babies, typically every 1.5 to 3 hours. Breast milk also contains the appropriate amount of nutrients for baby at the stage they are at, so no more than 3 to 4 ounces should be provided at one time. In the early months, some babies may only require 2 to 3 ounces per feeding. A baby's stomach cannot hold much more than 4 ounces at a time. Infants should be fed based on hunger cues and not on a schedule. Hunger cues include mouth movements, rooting, sucking on hands, and restlessness. Crying is a late hunger cue. Babies also cry for many other reasons and should not always be followed by a feeding. It is also important to understand and support whatever amount of breast milk mom sends. Mom should be encouraged to only send what she pumps, and the center should only use what mom pumps the day prior. It is also important to avoid large feedings an hour or two prior to mom's arrival. The center should avoid feeding the baby any breast milk 1 to 2 hours prior to mom's arrival, but if mom and the center agree that breast milk can be provided, it should be a small amount. This will ensure baby will be hungry when mom arrives and nurses a full feeding. This will also help baby and mom bond and also keep mom's supply up after returning back to work. Amounts of breast milk. During a growth spurt, breastfed babies will nurse more often, and some may be fussier. Babies will nurse more often to better meet their growing needs. This will also increase mom's supply to better meet baby's needs. In exclusively breastfed infants, milk intakes increase rapidly in the first few weeks, and then remains about the same through months 1 to 6. In the 6th month, solids are introduced and milk amounts start to decrease with that introduction. Physical growth is not the only time babies prefer to nurse more often. During developmental stages such as rolling over, crawling, walking, and talking, babies will nurse more often. Mothers and babies innately know baby's needs and will adjust mom's supply by nursing more or less. Many moms quit breastfeeding around these times because they feel they have an inadequate supply. With the support of child care centers and links to breastfeeding resources in the community, mom can be reassured that this is normal behavior, and as long as no other fluids such as formula are being introduced and mom has a well-established milk supply, then allowing baby to nurse on demand will help the baby get through this growth spurt. As baby grows, their nutritional needs change. Breast milk is designed to change as baby's nutritional needs change. Breastfed infants need no more than 4 ounces per feeding during the first year. The composition of carbohydrate, fat, and proteins will change to meet baby's needs in the same amount of ounces. Formula's composition does not change, and so we need to alter the ounces given to meet the baby's nutritional needs. How to feed baby. When feeding a breastfed baby, you should mimic breastfeeding, holding in an upright position. Switch from right arm to left arm halfway through the feeding. This allows for equal eye stimulation and facial muscle development. This also helps pace the feeding and keeps baby from preferring one side. You should allow the baby to control the feedings. Feeding a bottle is completely different than breastfeeding. Babies typically will take more from the bottle because a bottle does not require as much work to get breast milk out of the nipple. Many babies have full tummies but still will continue to take more milk because they cannot stop the flow. This can cause upset tummy, crying, and often leads to the caregiver feeling the baby is still hungry. Stroke the baby's lips with the nipple to elicit the baby to open wide and then allow the baby to latch. Feed slowly and use a slow flow nipple. Pause frequently and allow for burping. Breastfed infants will typically use the same facial motions and suck down bottles if they are not paced. Rapid feedings can cause overfeeding and upset stomachs, causing discomfort and crying. Stop feedings based on baby's cues. Do not focus on what is left in the bottles. This is another reason why it is important to store in small quantities. What if baby refuses the bottle? Some babies will prefer the breast and will not take the bottle. This is not a concern or a reason for mom to feel she cannot leave her baby. Supporting mom through this is very important. Reverse cycling may occur. This is where baby will sleep more during the day and eat more at night. This may seem daunting but can actually work well if baby sleeps in the same room as mom. There will be easy access for feeding. Some babies will just nurse more in the evening and sleep a 5-hour stretch at night and then stock up before mom goes back to work. Reverse cycling can work well and allow your baby to still get adequate nutrition as long as baby has full access to mom at night. Some moms actually prefer this because when they either don't have to pump or pumping very little when away from baby. Other things that can be done are feeding the baby in a completely different environment, feeding the baby in a different position, or trying the use of different containers such as syringes, cups, medicine cups, or spoons. Getting enough. The most important indicator is weight gain. If weight gain is normal, then there is no concern for baby not getting enough. Baby should have at least 6 soaked diapers a day. Spitting up can actually be a sign of overfeeding. It can also be normal. All babies have an underdeveloped sphincter which causes them to have reflux. Not good indicators are baby cries after feedings. Babies cry for a number of reasons. Assessing the baby's behavior before offering more milk is important. If mom says she can only pump half an ounce, this is also not a good indicator because moms' bodies respond differently to pumps, and often moms produce less from pumping than from breastfeeding. And baby will continue to take more after the first bottle. This is also not a good indicator because babies will typically take more from the bottle than from the breast and get upset stomachs and continue to cry afterwards. Bowel movements. Exclusively breastfed bowel movements are mustard color, seedy, and typically have a runny to pudding-like consistency. Stools can be green or orange, and there is no cause for alarm. Baby's stools can be green, frothy, and baby will be fussy if there is a problem. Diarrhea is uncommon in breastfed babies, and it is normal to have a yellowish, runny stool. There is no cause for alarm or to believe this could be diarrhea. By 3 to 4 weeks, many breastfed babies do not stool daily. Most likely you will see a pattern of every 3 days, but some babies have gone up to 20 days without a bowel movement. As long as baby is otherwise healthy and the stools are normal consistency, then there is no cause for alarm. Breast milk is well digested and there can be very little waste. What hurts supply? The breast works on supply and demand. The more the baby nurses or milk is expressed, the more milk the mother will make. If milk is left in the breast, this triggers a response to decrease the supply. When supplementing with formula or other expressed breast milk, baby fills up on these and does not nurse as much from mom, causing a decrease in supply. Some low supply triggers are supplementing with formula, using frozen breast milk that provides more than what mom pumped the previous day, introduction of solids, returning to work, pacifier use at home, feeding baby too close to mom's arrival, engorgement, lack of expression when away from the baby and skipping feedings, and then mother's illness. Some tools to increase supply. If mom has supply concerns, referring to a lactation consultant to discuss her supply is important. At the center, you can help mom increase her supply by giving only what was pumped the day prior and not supplementing with any formula. At home, mom can avoid the use of pacifiers and bottles, allowing baby to nurse as often as needed. Encourage mom not to skip her pumping sessions when at work. OSHA and the CDC both consider breast milk to be food and not a bodily fluid, so universal precautions are not necessary. There is no need for a separate refrigerator. Breast milk can be stored with all other foods. You do not need to wear gloves when handling breast milk, and you cannot contaminate breast milk by touch. Touching breast milk is not hazardous exposure nor a potential contaminant. How can staff support breastfeeding? Staff have the responsibility for care of the infants and should provide breastfeeding information to parents and support the mother to help continue breastfeeding when returning to work or school. Staff should understand that mothers may be emotional and have strong feelings about going back to work or school. Providing breastfeeding support may increase their confidence in the child care center. Put mothers in touch with other breastfeeding mothers at the center for support. Staff should also encourage mother to breastfeed on site at drop-off and pickup, and share written and online resources for breastfeeding and returning to work. When mom is having problems, referral to a lactation consultant should be made. Quitting is not the answer. Breastfeeding problems can almost always be solved with the help of a lactation consultant. You should also be accommodating for families. If mom is having a hard time transitioning back to work, reassuring her that baby is being well taken care of and staff are on board and supportive of her feeding practices. Ensuring mom that providing breast milk, she is still caring for her baby and providing the best possible nourishment for her child. An infant care plan should be developed for each infant at the center. This plan should be developed between staff and the family of the infant. The care plan should be supporting breastfeeding and should be updated regularly as baby's needs change. The care plan should be individualized for that infant. There should not be an across-the-board plan. Ensure that mother clarifies what she wants the center staff to do if her baby's hungry and she is late, or if her supply were to change. Encouraging mothers to breastfeed on site at drop-off and at pickup, allowing mother to nurse on her breaks should also be discussed. Introduction to solids. The AAP recommends exclusively breastfeeding until around 6 months. Breast milk provides baby with adequate nutrition until about 6 months. Around this age, if baby is showing signs of readiness for solids, it is okay to introduce solids with the parent's consent. It would be important to review the infant care plan at this time. Introducing solids is the beginning of weaning. Breast milk should still make up at least 75% of their caloric intake through the first year. This is a gradual process, and breast milk should still be the main component of the diet. Some good foods to start with are avocado, green beans, oatmeal, or banana. Meats can also be a first food. It is important to introduce meats as high iron sources early on to ensure baby is getting adequate iron. This concludes our module on Step 4. Introduction to solids. The AAP recommends exclusively breastfeeding until around 6 months. Breast milk provides baby with adequate nutrition until about 6 months. Around this age, if baby is showing signs of readiness for solids, it is okay to introduce solids with the parent's consent. It would be important to review the infant care plan at this time. Introducing solids is the beginning of weaning. Breast milk should still make up at least 75% of their caloric intake through the first year. This is a gradual process, and breast milk should still be the main component of the diet. Some good foods to start with are avocado, green beans, oatmeal, or banana. Meats can also be a first food. It is important to introduce meats as high iron sources early on to ensure baby is getting adequate iron. This concludes our module on Step 4.